This is Scoop Insight, and I'm Sandhu Narayanan. Recently, vape has been the talk of the town, with many people, they are advocating for its ban, and many people are saying that it should not be banned and it should be regulated. So today we are with Mr. Samsul Kamal Arrifin, who's the president of Pertubuhan Entity Vape Malaysia. We're going to discuss and we're going to talk a lot about it now. All right? Today?
Sure.
All right.
Thank you for having me.
All right. So a bit of your background.
Right. That is kind of interesting in terms of timing.
Okay.
If you look at what's happening now, this is exactly 10 years ago, to be exact, where we started off when the then Minister of Health announced that vape is going to be banned.
Okay.
It's exactly as what's happening right now.
All right.
Right. So that's where we started off when Dr. Subramaniam announced that vape is going to be banned.
Okay.
So a group of friends banded together, and we started off a movement online.
All right.
And we launched an online petition that got
Okay.
about over 60,000 support. And we brought the petition over to a few political parties.
Okay.
And it was then handed over to the then Prime Minister Najib Razak.
All right.
And the announcement of banning it was overturned.
Okay.
So interestingly enough, the situation right now that we have that vape is going to be banned is
Yeah.
exactly as when I first started off 15 years ago in
Okay.
2015.
Something like a deja vu now.
Yeah, it's been going on back and forth for
Back
the last
and
10
forth,
years.
back and forth.
Yeah.
Okay, now just for our viewers, can we have a bit of history about vape? When was it exactly started? Where did it all start?
All right.
Vape as a product.
The history of vape,
Yes.
as how it landed here in Malaysia.
Yes.
All right, that's an interesting question.
Yeah.
If I were to look back, vape kind of started off, say about 13, 12 years ago.
Okay.
And it didn't come from China. There was a spillover from Philippines.
Okay.
There's a lot of products that came over to our shores from Philippines. The liquids are from Philippines. The devices, which we call mods, are also from Philippines. That's how it got started.
Okay.
How I got started was similarly the same.
All right.
I saw these devices being posted on Facebook by my friends, and I was like, what is this, man? So I contacted one of my friends, and he said that this is vape, can help you to quit smoking.
All right.
So I wanted to quit smoking. I was a
Alright.
smoker, so I contacted him, and I said, okay, bring over all your devices.
Okay.
So he brought all his devices at this mamak restaurant. He put it on the table, and I said, okay, I want to quit smoking. And if I'm able to quit smoking because of this, it has to fulfill few criteria. Okay? It has to fulfill few criteria. Number one, it must satisfy my needs
Okay.
after makan lah.
Okay.
Yeah,
Your
because
cravings
normally lepas makan you have to like have
Yeah.
something in your hand, something come out from your
mulut
mouth.
kita akan gatal sikit.
Right.
Yeah.
And then number two is that it has to fulfill my needs when I go to the toilet lah. Okay.
Yeah.
Right. And number three is I don't know whether it's appropriate for me to say it, but whether it can fulfill my needs after.
Oh, okay. I get where you're coming from.
All right.
Okay. All right.
So
okay.
it did.
Yes.
It did fulfill all the three criteria.
Yeah.
And lo and behold, from that point on, which was about 12 years ago,
Okay.
I have not touched a stick of cigarette.
Yes.
Right.
All right. So it memang that was the purpose of why it was created lah, kan, for
To
people
quit
to quit
smoking.
smoking and things like that lah. So let's talk about this the proposed national ban on vaping, which was recently presented by our health minister on the 28th of July. All right. So from your opinion, you can just be honest with me, like who would be the key decision makers behind this move, to advocate for this ban?
All right, that's kind of a hot issue lah.
Yes.
I mean, if I were to spill the beans, let me just put it this way. As I said, vape has been, the regulation of vape has been going on back and forth for the last 10 years. Regulate it, ban it, regulate it, ban it. The thing is that I would guess the public perception would think that the tobacco companies would want it to be banned, because then people will go back to smoking.
Yeah.
Correct?
Yeah.
But that's not true.
Okay.
That's
all
not
right.
true. That's not true. The big tobacco are all for vape to be regulated.
Okay.
All right? But the big pharma is the one that's against it.
Big pharmas.
Yeah.
All right. Okay.
The big pharma is against it. The big pharma who is then making this very orchestrated movement. If you were to view media, you can see that it is very organized lah.
Okay.
All the fear mongering, right?
Alright.
It's very organized. I mean, it is not just by coincidence. It is actually by a concerted effort, a very organized effort by the big pharma.
Okay.
Why?
Yeah.
Because they have their products to push, their nicotine patch and their nicotine gum.
Gums,
Unfortunately, right, this
Yeah.
is from my personal point of view, and data supports this. We who wants to quit smoking have tried nicotine patch, have tried nicotine gum.
Doesn't work?
It didn't work.
Okay.
Because it's just not about getting the nicotine fix, you know. It's
Okay.
also about habits. Lepas makan kan, you need to have something in your hand.
Yeah.
And if you put a patch, you know, it doesn't fulfill that need
Yeah.
of the habitual needs. It's not fulfilled.
Yeah.
So then we tried. It's not that we didn't try. You know,
Yeah.
before vape came about, we tried whatever that exists lah to help us to quit smoking.
Yeah.
You know, it's just unfortunate that we started smoking. That's the unfortunate thing. But then we decided that we want to quit. So we tried the gum, we tried the patch. It didn't work. Vape worked. Vape worked for me. And vape worked for millions of people.
Yeah.
In fact, it works so well in UK now. The health ministry is handing out vape products for people who wants to quit smoking
Okay.
in UK.
Alright.
Right. So if you were to ask me, who's behind it, that's the answer. The other thing that I want to put forward is this. Before any big decision is made, like banning vape,
Okay.
I'm hoping that the decision is based on facts,
Okay.
not based on perception.
Alright.
Right? So now there's a lot of perception that's been going around.
Okay.
I think all this started off is because there were some cases that a few individuals were hospitalized
Yeah, masalah
due to
paru-paru.
vape,
Yeah.
masalah paru-paru.
Paru-paru,
But that's not
yeah.
accurate, you know.
Yeah.
It is because the product that they use is laced with drugs.
Okay.
So it is really not a vape issue.
Alright.
It's a drug-related issue
Dia
lah.
macam dia tambah THC dalam macam tu lah.
Correct.
Yes.
Correct. So then, don't conflate these two matters together lah. There's a vape issue here and there's a abuse of drug issue here.
Yeah.
So then that's the perception. Perception is that vape is causing all this. That's the perception. The fact is that it is actually a drug problem.
Drug problem.
So now everyone is rushing to enact a law, a ban, based on perception, not based on facts.
Yeah, but do you think the perception is being created because now if you look at the products, alright, or you look at the devices, you know, it's accessible lah. You know, it's kat semua tempat ada, dekat kedai mamak pun ada, because correct me I'm wrong, okay, dekat dulu kita ada vape store kan, dekat vape store semua kita untuk beli flavor semua pada zaman dulu, when I started about 10 years ago.
You vape.
I used to be a heavy smoker, then I turned into vape lah.
It worked for you.
It worked. It
Great.
still works.
Alright.
But the thing is, when I started 10 years ago, produk-produk macam even the flavor ataupun the devices, I will get it at certain stores lah. Tapi zaman sekarang, it's available everywhere. And now
Even online.
Yes,
Alright.
and even disposable
Right.
products are there, you know, dekat kedai mamak semua kan. And because of this, kedai mamak pun they are not very strict, like, you know, dekat vape stores, okay, they are in a way strict lah, like below 18 you cannot buy. Alright. Tapi kedai mamak semua mereka boleh lepaskan. Macam, like for example, my elder brother who is above 18 can go and buy on behalf of me. Alright. So is this one of the reason why, though you are saying that, you know, could be perception and things like that, right? You know, because many people are, you know, it's becoming a trend nowadays, and it's getting too accessible. Is this one of the reason why people are pushing for the ban?
Right. Okay, when I was talking about the perception, I was talking about the drug-laced products.
Yes.
Okay, the wrong perception is that vape is causing this, but it's not.
Yeah.
It's the drug-laced vape products lah. But when we come to the social problems that vape is creating, we are not denying it.
Yeah.
Okay, move as a consumer movement for vape products. We do acknowledge, and we are not defensive about this. Yeah, we do acknowledge that this is a serious problem,
Okay.
which needs to be handled,
Okay.
and it needs to be handled correctly. All right, so it is a problem. I think I have to make it clear that vape should not be a trend.
Okay.
Right, vape should not be something jadi ikutan, fashionable. No.
Yeah.
Vape are for people like you and me who have decided that we want to quit smoking.
Yeah.
That's what it's about.
Yeah.
And in United Kingdom, the Public Health of England, PHE,
Yeah.
have done numerous studies to conclude that vape is 95% safer than smoking.
Yeah.
Very accurate.
Yep.
They are not saying that vape is more or less safer than smoking.
Yep.
It is very accurate. Again and again, numerous tests has been done to conclude that vape is 95% safer than smoking.
Yeah.
So then we have to look at it from the angle of harm reduction lah.
Yep.
You know why? If you ask me, kenapa masalah ni tak boleh settle for the last 10 years?
Yeah.
I'll tell you right now.
Yeah.
Why?
Yeah.
Okay, because there are many entities that is involved.
Okay.
All right, government agencies, enforcement agencies, pro vape advocacy, anti-vape advocacy,
Advocacies.
parents union,
Oh.
consumer group, macam-macam.
Macam-macam
Yeah, macam-macam body that is involved. You know, there's a lot of stakeholders that is involved in this issue.
Okay.
It is a big issue.
Alright.
It is a national issue.
Alright.
Now, why it cannot be resolved is because the issue sits here in the middle.
Yep.
Okay, regulation of vape,
Yep.
and all these entities is looking to the issue from a different lens.
Yep.
Okay, now let me tell you my lens
Okay.
from a consumer movement
Yep.
or as a consumer,
Yep.
as an individual.
Yep.
Okay, I'm looking at this issue as a vape as a harm reduction tool,
Yep.
and that's it.
Yeah.
You know, it is helping me to quit smoking
Yeah.
because it is a safer way to deliver nicotine.
Betul.
Itu saja.
Betul.
Right? If we
Yeah,
were to look at it from that point, from that angle, from that lens,
Yeah.
then all these problems can be solved.
Okay.
Unfortunately, all these other entities are not looking at it like that.
Okay.
You know, they are looking at it as something that can causes death.
Yeah.
There's so many misinformation,
Yeah.
malinformation out there. You know,
Yeah.
dulu masa kita first started, they say if you vape kan, you suffer from erectile dysfunction.
Yep.
Right?
Yeah.
I'm married. You can ask my wife lah. There's no problem there. Okay.
Yeah, okay.
So, the misinformation. You know who made this statement?
Okay, siapa?
Association of Young Doctors.
Okay, alright.
Alright, so there's a lot of malinformation here, you know,
Right.
with I don't know what's the intention lah, you know,
Right.
but these are not accurate.
Tanpa buat any fact checking lah. Make it just as
I don't know how they
perception
derive to this lah.
Okay.
I do not know. Let me then again, probably kalau boleh, let me
Yeah.
just enlighten you guys a bit lah.
Yeah, boleh go ahead.
What's inside a vape liquid?
As far as I know, there's a vegetable oil. There is PGVG.
Elements that you
there's-
make ice cream and cakes.
Yes.
Is it dangerous?
And there's most of it food flavoring lah. Tak silap saya lah.
Flavoring.
Yes.
PGVG are things that you make ice creams and cakes.
Yes, and a bit of nicotine.
That's it.
Yeah, and
That's
there's something called glyco.
That's PGVG lah.
PGVG lah, yeah,
PGVG are actually palm-based oil.
Palm-based oil, yes.
Things that you need, you use to make cakes
Yes.
and ice creams.
Yeah.
You know, and you add on a bit of flavor
Yes.
and a bit of nicotine.
Yes.
Of course, nicotine has been ostracized lah.
Yes.
The main thing about it is nicotine. But there's so many studies that shows that nicotine are actually very therapeutic.
Yeah.
There's a lot of nicotine in food you consume every day, tau.
Oh, I didn't know that.
Of course.
Any examples?
Coffee.
Coffee, tapi
Vegetables, fruits, ada nikotin dalam kalau you makan.
okay, coffee mainly caffeine kan, tapi ada juga lah nikotin lah.
Ada.
Okay.
Alright, so that's the thing, you know. I mean, with the right amount is therapeutic.
Yeah.
Anything that is excessive is detrimental to health lah.
Ya, betul.
Kalau you minum plain water excessively pun you boleh mati.
Yeah,
So
yeah.
anything excessive is detrimental, but then we are talking about the correct amount.
Correct
You know,
amount.
the correct amount of nicotine is very therapeutic. I didn't say this.
Yeah.
Go and Google it. There's a lot of research that can back this up.
Yeah. Actually kalau kita tengok dalam sudut ini kan, kebanyakan masalah-masalah ni antara the main punca is the liquids. Alright, like you said, even though you gave a breakdown on what are the ingredients dalam liquid tu, ada sekalangan people yang nakal tu, they like to buy like, I don't know how they transport big amount of liquids. I don't know how they even do their mixings and things like that, because even PDRM has been catching a lot of, there are a lot of cases like this out there lah. When they do things like this kan, because as far as kita tengok if you look at the stats from October 2024 alone, we can see that the brands, the variants dalam vape products, from 3,000 brands, now we only have around under 400. So, is this a bad signal for the vape industry as a whole?
Yeah, of course.
Yeah.
Of course. The industry has shrunk somewhat.
Yep.
At one point, say 7-8 years ago,
Yep.
Malaysia was the second biggest consumer market in the world for vape products.
Oh, second biggest.
Second biggest, yeah.
Yeah.
We were just behind UK at that time.
And we used to earn, correct me if I'm wrong, around roughly 1.8 billion, you
Yeah.
know, around there. Yeah.
Right.
Yeah.
And Malaysian liquids and Malaysian devices were the most sought after in the world.
Okay.
Right? So it's so unfortunate that because of all this misinformation and fear mongering, the industry has shrunk lah.
Yeah.
But that's fine. That's fine. As long as we can regulate it lah.
Yes.
When we regulate, of course, eventually we wouldn't see that many brands.
Yes.
That's just a natural progression.
Yes.
Right? So as you were saying, from 3,200 brands now is about 390 brands, below 400. These are because I guess the government now is imposing law that they have to register their products. They have to submit their ingredients to MOH. This is why not many players are able to do so. That's a good thing, Kita tak nak the manufacturer of vape liquids buat belakang tangga kat belakang dapur. We don't want this.
Okay.
So only those who are qualified buat lah. I have been involved in the libat urus lah with MOH so many times. And I even tell them that let's set the ceiling to qualify very high.
Yeah.
Let's not make it very easy for these people to manufacture vape liquids.
Okay.
Because this is something you put in your body,
Betul.
So it has to be absolutely safe lah.
Yeah.
Right? So this is why you can see the numbers of brands are shrinking. It's because not many are able to meet the requirements.
Yeah. Okay.
It's a good thing to me. It's not a bad thing. Yeah.
It's a good thing.
Yeah, it is.
Alright.
If you are not able to meet the requirement, then don't get involved lah.
Yes. Okay, there's another talks among the advocacy groups. Mereka kata macam, let's say kalau vape is banned, alright. So kerajaan, they ban the vape kan. Ada potentially, users may revert to traditional cigarettes, or vape will be sold in the black market. Benda-benda macam ni kemungkinan akan berlaku lah. So what's your take on this?
Right.
Yeah.
I've been asked this question many times.
Okay.
So obviously we have done our research lah. This is not something that we pluck out of the air, out of thin air. We look at examples of countries that has banned vape.
Yeah.
Singapore, for instance, our neighbor. Australia, for instance, or India. Banning vape did not work. In fact, the consumption of vape in Singapore has increased after it is banned.
Okay.
Alright, so then because there's a spillover from the neighbouring country.
Yeah.
Which neighbouring country, I tak nak cakap lah. Okay.
They buy in big bulks lah, before they go back. Yeah.
Right, so then my point is that banning did not work in Singapore. Right, banning did not work in Australia.
Yeah.
Let's look at India. Banning did not work in India as well.
Yeah.
Okay, because there's a lot of black market or illicit products that is available.
Yeah.
Now, katakan kita ban vape kat Malaysia.
Yeah.
I can tell you with almost certainty lah, this is what's going to happen. Okay, there's going to be an influx of illicit products.
Okay.
Okay, it is still going to be available.
Yes.
It is still going to be accessible, but the danger is that it is not controlled because it's not regulated, kan? It's banned. And then these products are not tested. You tak tahu produk ni selamat ke tidak, tak selamat. You don't know what is the nicotine content in this product. There is no child-proof packaging, and they can just package it in any way they like to attract kids and all that. Can you control it? You cannot because it's not regulated. So then people would say, of course lah, Sam, boleh enforce what? Enforce. Okay, let me just give you a few statistics. Illicit cigarettes has been a major pain lah for Malaysia. What's the status now? Is it still going on?
It's still going on, yes.
Of course
they are
lah.
still finding a lot of cases like that, you know. And I think PDRM
it's
is also
rampant, kan?
Yeah, they are working closer with MCMC.
Right.
Yeah, to track down it's all being sold on social media.
It's rampant, kan? I mean, illicit cigarettes.
Yep.
Right. So my point is that kalau masalah yang dah wujud for tens of years pun tak boleh selesai because illicit cigarette is not legal, so you have to supposed to enforce it. You cannot do it because you tak cukup kaki tangan.
Betul.
Now sekarang you nak ban vape. I would think that is also a problem to enforce. Okay, so then the product is going to be available. You tak boleh control. Who is at the losing end here? Let me tell you, category of entity is at a loss.
Okay.
Number one, the biggest loss, public health.
Okay.
Alright, because elok-elok orang boleh berhenti merokok menggunakan produk yang diluluskan dan selamat.
Okay.
If it's regulated. Now
If it's
because it's
regulated,
banned,
yes,
they cannot use it and they are exposed to maybe illicit product that is not safe.
betul.
Okay. Satu lagi about public health. You merokok, you nak berhenti merokok, okay, and vape is already
A safer alternative.
safe alternative is concluded, kan? So then it can save in terms of kita punya non-communicable disease lah.
Yeah.
In terms of cost, it's been said that we spend 8 billion per annum on non-communicable diseases. So that could help. Okay, so public health is at a loss. Number 2, who is at a loss? The business people.
Business people.
Number 3, who is at a loss?
Yes.
Government tak dapat collect tax.
Yeah, betul.
Yeah, so if you were to do it correctly, tiga-tiga menang.
Yeah.
If you ban it, tiga-tiga kalah. This is why I need people to see this point.
Yes.
If only you were to see it as a harm reduction alternative, harm reduction tool, then all three parties can win.
Yeah.
Public health, the business people, the retailers lah, and also government.
Yeah.
So the banning is not the answer.
Yeah.
Stricter regulation is the answer.
Kalau kita kalau kita tengok daripada sudut business pun, tak silap saya ada roughly 1,300 retailers in our country lah, roughly lah, approximately lah. So yes, like as you said, if you ban, I mean, what jobs are they going to do, kan? Like after this, like
there has been talk lah.
Yeah.
That cakap mungkin there will be some training provided to these people for them to transit to another business.
Alright.
I don't see that happening lah.
Why?
Because these people specialize in what they're doing lah,
Yeah.
Right. So it's not easy for them to transit to something else.
Yeah.
Then who's going to take the responsibility to train them?
Betul.
Right. Number one. Number two. What about the losses?
Yeah.
That they are incurring?
Yeah.
Okay. I mean, again, let me put it this way, like, it's just not about business tau.
Yeah.
What's happening with vape here is that if it is managed correctly, it is saving lives tau. It is actually saving lives.
Yes.
This is the way I look at it.
Yes.
Right? So then, your question was about what's going to happen to these people.
Yes, retailers lah.
Retailers lah kan. So they're going to be wiped out lah. Probably what's going to happen to them, most likely, they are going to morph into selling illicit vape products.
Okay. Yes.
Right?
So you have to cari makan mah.
Of course lah.
No choice lah.
That's the only thing they know what to do.
Yeah.
And I would also anticipate a surge in online sales lah. Right?
Yes.
Then they say that they can control online.
Yes.
Good luck with that.
Yeah.
Because they even been sold on Telegram.
Yes.
How are you going to control that?
They never say that they're going to control, but they say they are working together to make sure that they can stop it from booming lah.
Who is working together?
PDRM and MCMC.
Oh, okay.
Yeah.
All right.
Hopefully it works. Yeah.
I hope so.
So, but one thing bothers me a lot, because when we talk about this accessibility, vape, sometimes aku bengang juga when I see young kids who are, baru, like they can be 10, 12, some of them 14. Aku tengok pakai baju sekolah dia isap-isap kan. So let's touch a bit on the we touch a bit on the under 18 punya selling lah.
Sure, let's go there.
Do you think that it really works? Because I still don't understand why dekat kedai mamak semua mereka still boleh jualkan kepada budak-budak ni, and should they do more beyond the existing restrictions under Act 852 that ban sales to those under 18 and require age verification at point of sale?
Your question is what else should be done?
What else should be done
to curb the abuse of vape products by minors?
Because the under Act 852, I feel it's not working lah still.
Right.
Yeah.
I agree. Look,
Yeah.
I have two boys.
Okay.
One is 21 years old. The other one is 16. 16 years old. Do I want them to vape? No. Right? Do I want them to smoke? No. Do I want them to have access to vape products? Of course not.
Yeah.
Right. So what needs to be done? I was caught many times in engagement with MOH.
Okay.
with Ministry of Finance even.
Okay.
So we have put forward a few cadangan lah, right? Number one is that make sure that vape products can only be sold in specialized stores.
Specialized stores.
What does that mean? Vape product can only be available dekat kedai vape lah.
Yeah.
Alright. Now why? Because senang nak control. Okay. And these pekerja-pekerja dekat kedai vape, they are more trained.
Yeah.
Okay. They are more trained than pekerja dekat kedai mamak. Right?
Yeah.
Number one. Number two, storage. Okay. Do these people dekat kedai mamak ni tahu ke macam mana nak store benda ni to make it safe? Right? Number tiga is accessibility lah. We're talking about regulation. How are you going to regulate? Regulate means in BM kan kawal, selia.
Kawal.
How are you going to kawal when it is everywhere?
Betul.
Dekat kedai mamak, dekat kedai Aceh, dekat petrol kiosk, macam mana nak regulate? Right? So we suggested that vape can only be made available dekat kedai vape specialized store. Number one. Number two, bila nak issue lesen kat kedai vape, make sure that the address is at certain proximity to the closest school. Can make sense tak?
Yeah, makes sense. Yeah.
Right, right. Kan? Janganlah ada kedai vape yang depan sekolah.
Okay.
Right? So why not consider that? Okay. Number tiga, it's called geo block tau. You can actually block internet access to vape websites.
Okay.
You can do the same to porn as well.
Yeah.
You can block it, right?
Yeah.
So the same thing that you should do, geo block it.
Geo block it.
Yeah, geo block it in terms of vape website. Don't make it accessible to students.
Yeah.
But let me tell you this. I work closely with the stakeholders lah. The business people of. I don't own any vape business. We represent the consumer group. Yeah, we don't run any businesses. But I do have a lot of friends who have vape shops. And they self-regulate tau.
Oh, okay.
You know what self-regulate means?
No, you need explain. Can I explain?
Okay.
Yeah.
They are very sensitive in terms of who they let in the shops.
Oh, okay.
You know why?
All right.
Because they want to protect their business.
Yeah.
They know that if they let minors in, then they are going to get in trouble.
Yes.
They are running a business. Do they want their business to be in trouble? No. Most of them, I would dare say all of them, self-regulate. Diorang tak benarkan student masuk ke kedai vape. Right? If it seems that this person is questionable, then they will ask for identification.
Betul.
Right? Because they do not want to get in trouble.
Yes.
And if they do so, they will get in trouble.
Yes.
Right? They do not sell to minors. They do not sell, especially if you are in school uniform. You are not allowed to come in.
Yeah.
But the problem sometimes, I'm not saying it's rampant.
Yeah.
The parents are okay with it. So ada satu case ni di mana this student nak beli vape tak dapat, was denied, was asked to get out. Then dia bawa parents dia datang.
Ayo.
Then parents dia beli. It happens. So again, my point is that parents pun kena main peranan lah.
Yes.
There's many stakeholders tau dalam cerita ni. So all stakeholders have to play a role. Like me, as I say, I'm a father of 2 boys.
Yeah.
Right? I do not want them to vape. The sad thing is that kan, these children vape, but they are not smokers tau.
Yeah.
Yeah, that defeats the purpose lah.
Yeah.
As I said, vape shouldn't be a trend. You know, that's why packaging needs to be less attractive to children.
Yeah, because sometimes I feel like children also, like kalau kita tengok zaman sekarang okay, zaman kita semua kita start rokok dulu, lepas tu kita transition into vape. Tapi zaman sekarang punya kids semua straight away they start vaping already.
Correct.
So that is also a problem kan?
It is.
This is a problem.
It is.
Yeah.
Yeah, we are not being defensive by saying that this is not a problem.
Yeah.
It is a social problem.
Yeah.
It is a serious problem and it is on the rise.
Yes.
This is why banning it is not the answer.
Yeah.
The answer is a stricter regulation.
Stricter regulation.
Because kalau you ban, these kids are still going to vape.
Yep.
And they are going to be exposed to products that is not approved, not tested, not safe.
Yeah.
Is that what we want?
Yeah.
You see, the thing is that as long as there is a demand, there will be a supply. Okay, drugs have very heavy penalties.
Yep.
It is still available
because
there is a high demand. Same goes to vape. As long as there is a demand, there will be a supply.
Yeah. Okay, now sekarang kita ada Johor, Kelantan, Terengganu, Perlis, Kedah, Penang and Selangor. Alright, they're already enforcing and they're considering on a vape ban kan. So how long will it take for our current government to make it nationwide?
How long will it take?
Yeah, for a nationwide ban.
Okay, with the current provision,
Yeah.
Akta 852,
Yeah.
what is the difference between banning it and enforcing Akta 852? Akta 852 is actually tak ada prohibition about Akta 852.
Yeah.
There is no prohibition. Akta 852 is regulation,
Yeah, betul.
right? So if they were to ban it, they have to enact a new law lah.
They have to come out with a new acta or something lah.
Correct,
Yeah.
correct.
Or
So then
amend it
there will be
lah.
a federal law
Yeah.
that has to be enforced on all the states.
Yeah.
Let me just touch a bit about if the federal government is not going to ban it,
Yeah.
which I think they are not going to ban.
Okay.
Because kalau kita tengok rancangan Malaysia ke-13,
Yes.
PMX ada announce there's
The
going to be a
pro-health
health tax kan.
Yes.
So kalau you nak ban, kenapa you nak increase tax on vape? Betul tak?
Betul.
So I think lah it's not going to be banned. So then all the other states ada the autonomy to actually ban it.
Okay.
They can, the states that you mentioned.
Yeah.
So the states that's already banned is Kedah,
Yeah.
Terengganu, Kelantan, Perlis. Okay, the rest are considering. So what's the problem here? Kalau these states were to ban vape, don't they think that there will be a spillover of vape products from states that did not ban it?
Exactly.
Kan? So what's the
Yeah.
point?
Yeah.
What's the point, kan?
Yeah. Yeah.
So
But-
that's the loophole that I see lah.
Yeah, but let's touch a bit on the pro-health tax, right? So, from your opinion, how is it going to be? So after this, are we going to see a standardized vape products? Like there's only going to be one sort of nicotine strength in the device, the volume of liquid.
That's already the case.
Oh, that's already the
That's
case.
852 lah.
Yeah.
That's 852. There's a certain amount of nicotine that is allowed.
Yeah.
There's only certain number of ml that is allowed in a bottle of liquid. That's already in place in Akta 852.
Yeah.
But when you talk about tax, kan, the question should be, adakah increase of tax will deter people from consuming the product?
Yeah.
Betul tak?
That's the thing. Yeah.
Okay, let's go through economics 101 for a
Yeah.
while.
101.
Okay, demand supply.
Yeah.
Okay, kita tahu kalau harga naik, then demand will decrease.
Yeah.
And supply will, kalau supply naik, then price will decrease.
Yeah.
These are the demand supply lah
Yeah.
yang kita belajar kat sekolah dulu
Yeah.
kan. Tapi bukan semua produk conform to the principles of demand and supply tau.
Yeah.
Okay,
Yeah.
because they are products that has inelastic demand.
Yeah.
Ni economics 101 sikit
Yeah.
Then there are products yang ada elastic demand. Apa maksud elastic dengan inelastic ni? Okay, elastic demand adalah produk yang akan how should I say correspond kepada kenaikan harga.
Okay.
Okay, dia elastic.
Okay.
Okay, elastic products are products that corresponds to the increase of price.
Okay.
Bermaksud kalau tax increase, harga naik,
Okay.
dia akan bergerak accordingly lah.
Okay.
Bermaksud dia punya demand akan turun.
Okay.
There are products like most products are like that.
Yeah.
Unfortunately, vape,
Yeah.
cigarette, alcohol are not like that.
Yes.
They are inelastic.
Yes.
Meaning to say,
No matter how much you increase the price,
the demand still there. Dia
lah.
inelastic
Yeah.
tau. So dia akan turun sikit lah.
Yeah.
Tapi dia tak turun sebanyak mana yang sepatutnya.
Betul.
Okay, it will still have an effect.
Yes.
Okay, but it will have not the effect that you want. So then, what's the objective of this tax increase? From what I know, it is for deterrence lah.
Deterrence.
The tax collection, tax revenue is secondary.
Yeah.
Yeah, but it seems that if the demand do not decrease, then the tax will, with the tax increase, then government will have a boon in tax revenue.
Yeah. But what systems do you think that will take in place to collect and enforce the vape punya tax efficiently lah? Like how will compliance be monitored among the importers, manufacturers, retailers?
Okay.
To prevent tax evasion or illicit trade.
Okay, this thing is already in place dengan Akta 852 lah.
Okay.
Siapa-siapa yang nak import ataupun nak bawa masuk vape liquids,
Yeah.
they have to register
Yeah.
dengan custom.
Custom dulu lah.
Yeah,
Okay.
correct. Then they'll be issued a sticker lah.
Okay.
Right. So that is to state that product dah bayar tax.
Okay.
Okay, that's one. Then of course with the jual beli transaction of jual beli lah,
Yeah.
sales tax kan. So there should be an excise tax and also sales tax. Okay, sales tax conform to SST lah. And for the device, there's also a 10% tax on device based on its price. And for liquid, there's a 40-cent tax per milliliter, if I'm not mistaken, yeah. So that's the tax punya structure for vape products. And it's not something that you can easily maneuver lah. Yeah, yeah, you have to pay lah.
Yeah.
Because the penalty of you evading it is very heavy.
Okay. Alright. So just nak tanya juga ya. Okay. I'm curious to know about this because the tax yang mereka akan collect tu, we don't know how much is it going to be like for the end of the year macam tu kan. So what will be, from your opinion, the tax should be focused on which side? You know, should it be more on the healthcare spending or public education campaigns? You know, enforcement operations or support for those affected by, you know, any diseases or things like that.
Right. Your question is that what is going to be used with the tax revenue? As if I can recall, the last time I read, it was about 118 million tax collected. And PMX did mention that 50% of the tax revenue is going to be allocated to MOH. Okay, for infrastructure, for training and such. I'm not sure what else is it going to be used lah. Tapi 50% of it is going to be allocated for MOH. That's what I read. Yeah.
But what should it be mainly used for? Like for example, now we have this setengah pihak yang tengah misusing the liquids and all things like that again. Should they come up with more like, you know, enforcement officers, you know, to make sure that, you know, benda ni tidak berlaku and things like that?
Oh, you mean
support the industry?
The budget should be used in terms of enforcement.
Yes.
Yeah, it is also has been earmarked. Part of the tax revenue is going to be for enforcement. Yes. It's been earmarked.
Yes.
Yeah.
Okay, now from Move's perspective,
sure.
There have been a growing reports like drug-laced vape products being sold in the market, you know, and things like that. So, how serious do you look at this? And, you know, will this one day destroy the identity of the vape industry in our country?
It is very serious. It is a serious problem. I read in the news that 67% of the products that was seized, yang dirampas lah 67% of it has drugs in it.
Yeah.
Okay, so that's serious, right?
Yeah, macam fentanyl, piao-piao, on this kind of drugs. Yeah.
Right. So how can this happen? Let me break it down in a few ways. There are two types of vape devices. Satu kita panggil open source and satu closed source lah. Macam disposable. Disposable, you pakai, you buang.
Yep.
So it's a closed system.
Yep.
Alright? So it's supposed to be safer.
Yep.
It comes from the factory and it's closed. You cannot tamper with it.
Yep.
Okay, the other method is called open system, that you have to put in your liquid in a tank.
Yep.
So the understanding is that this is the method that has been abused lah.
Yep.
Okay, they add on things and all that. Unfortunately, it's true. But why I say it's becoming more serious is because the closed system also now comes from overseas, laced with drugs. The closed system means to say they have already mixed drugs from the factory.
The disposable one also lah?
Yes.
Oh, okay, wow. So they macam, dekat factory, so macam they inject something. Oh, wow.
It's a closed system, but it's already laced with drugs.
Yeah.
So if you ask me whether it's serious or not, yes, it's serious. Okay, it's really serious. So again, as I said, let's not conflate the two issues here. One, we have the issue of vape product. The other issue, kita ada drug abuse. So these are two separate matter tau. So kalau kita dapat produk ni mengandungi dadah, you then should guna akta dadah lah. Right? So it's a more serious problem. But unfortunately, vape has been dragged down with it. Yeah. As to your question kan, will it affect the perception of it? Definitely.
Tapi I nak tanya, because sometimes it comes in a packaging of the vapes that we all use, kan? So how to make sure that, you know, how can we check like, okay, bila kita ambil daripada retailer ke distributor ke, like benda tu ada darah ke tak? You know, because now it comes in lebih kurang the same packaging kan.
How do you know? How would you know? Is it?
Yeah.
That's your question.
Yeah, how would
You wouldn't know.
Oh, okay.
You wouldn't know. I guess the buyer would ask for it. Can I have certain brands or certain vape products? But then for the enforcement, as far as I know lah, tak ada device yang boleh buka liquid tu and dip something and see whether there's a drug inside it. There's no such approach.
Okay.
You wouldn't know.
Alright.
Unless you just bring it back to the lab and you do some lab tests. It's a very extensive process. But if you were to test it immediately on the spot, no, you can't. You can't know. It's not like a breathalyzer. You take you breathe upon the machine, then you know whether someone is drunk or not. It's not like that.
Or like a drug test kit or something like that.
It's not. It's not like that.
Yeah. So that's the thing, because sometimes why I was thinking about this, maybe cadangan ini boleh dilakukan dekat vape stores lah kan, because so that consumers will know whether this vape store guy whether he's selling a legit product or not.
Right, okay.
Because now we don't know again.
Itu senang aja actually, because sekarang all the approved vape products dah ada label.
Yeah.
There's a sticker. So just by visually you can see whether this product has been approved by MOH or not.
Okay.
Okay, so those without the sticker tu you jangan beli lah.
Okay.
So that's the best way to go about it.
Tapi pelik juga kan, approved daripada MOH, tapi MOH juga yang cadang nak ban it nationwide.
Again, as I said, it's been going back and forth for 10 years.
It's confusing. Yeah.
It is. So Menteri Kesihatan Dr. Zul cakap they are now looking at banning.
Yeah.
Then PMX through rancangan Malaysia ke-13 cakap there is a
Pro health tax.
Yes. So which one is it?
Yeah.
Kalau kata you
so
nak ban,
confused,
then kenapa you are considering on having this health tax for vape product kan?
Exactly.
But of course, what Prime Minister say carry more weight than the Minister of Health lah.
Minister of Health lah, kan? But
yeah.
it's going off and on.
Yeah, it's been back and forth for the last 10 years lah.
Okay, so has MOF received any indication that authorities are, increasing the inspections or enforcements related to drug-laced products, and I mean, in their particular vape stores and things like that, ada apa-apa checking ke tak, things like that over the past 1 year?
I have heard.
Yes.
Bert told me lah.
Yeah.
There in August, this month lah kan?
Yeah.
This is 1st of August. There's going to be a massive operation.
Oh wow.
Yeah. It's called Ops Paru-Paru or something
Ops
like
Paru-Paru.
that. Yeah, something like that.
Okay,
Yeah.
interesting. Ops Paru-Paru.
Anytime now lah.
Anytime.
Yeah.
Okay. So maker punya mission is to check all the vape stores, and to see whether
Seize all products that is not approved by MOH.
Okay.
Is it wrong? No, it's not.
Yeah.
I'm glad to see enforcement in this scale.
Yes.
I mean, all vape shops only are supposed to sell products that has been approved.
Yes.
Yeah, but they have been given a grace period.
Yes.
Yeah, they have been given a grace period of 6 months in order for them to transit to approved products.
Yeah. But do you think that approximately how many unregistered vape products are there in the market approximately, which is
Now?
not registered by
Now?
MOH? Yeah.
You mean if I were to walk in a vape shop?
Yes.
Okay, let's look at it this way.
Okay, because
I walk in the vape shop.
bila kita masuk vape shop kan, ada banyak produk, banyak flavor semua kan. So roughly about how many percent? Yeah.
Hard to say lah, tapi if I were to
Anggaran.
approximate lah
Yeah.
I would say maybe 30-40% registered products.
Oh, so remaining 60% is not registered products lah.
Yeah.
Alright, so I think how do you look at this, the credibility of the industry lah, now with all these kind of issues and things like that, right? Will the public, like for example, like my uncle who's a heavy smoker, he turned into vape. So now we'll tengok isu-isu macam ni tengah berlaku semua kan. The credibility of the industry is in a way being damaged a bit. So in a way, this particular person can revert back to smoking and blah 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 again. So on a long-term period, how do you look at the credibility of the industry?
That's the sad thing, isn't it?
Yeah.
Right. As I said earlier on, sometimes what we do here. No, I personally am going through what we call a advocacy fatigue.
Yes.
Dah penat tau.
Yeah.
And we've gone through this for 10 years already. It's been going back and forth. And it's sad to see that people who genuinely want to quit smoking,
Yeah.
because of all this misinformation, malinformation, fear mongering, they takut,
Yeah.
right? And then they revert back to smoking. Kan? So, a few things I want to say here. There are a few ways for us to correct the situation. When the perception is actually shaped at mass media,
Yeah.
okay, normally perception are shaped at mass media by politicians, by policymakers, kan? And we believe that we can counter the perception at social media. Correct? Wrong. You cannot. If the perception is actually created at mass media, it has to be counted at mass media.
Mass media, yeah.
Right? And we think that social media is powerful. It is. But let me just say this. When you scroll through Instagram, Twitter, or Facebook,
Yeah.
or TikTok,
Yeah.
right? It then understands your algorithm, correct?
Yes.
Right?
Yeah.
You're in media. You should know this, right?
Yeah. Yeah.
Okay. So then, if I were to keep looking at cats videos,
Yeah.
video kucing, that's all I'm going to see lah.
Yeah.
Betul
Yeah,
tak?
betul.
Alright. So now, let's look at it at what's going on right now. If I am a anti-vape person,
Yeah.
and I now scroll through social media, and I read and watch videos that are anti-vape,
Yeah.
and that's my algorithm,
Yeah.
correct?
Yeah.
So I am going to keep looking at anti-vape information or misinformation. Now there's a body here yang nak counter this.
Yeah.
Okay, katalah okay, we need to do something. We need to shoot off the correct narrative,
Yeah.
shoot off the correct messaging. Okay, dia pun go on social media. Will this person here now receive this message?
Yeah.
No, they won't. They will not receive.
Yeah.
Because dia punya algorithm is
Yeah.
anti-vape.
Betul.
So the pro-vape punya message tak sampai kat dia.
Betul.
At the same time, yang pro-vape pun sama juga. All the anti-vape message tak sampai kat dia. So my point is this. Yes, I acknowledge the power of social media, but social media won't be able to move the needle towards the right perception or the right information or the facts. It will not. If the narrative or the perception has been created at mass media, it has to be addressed or opposed or corrected at that level.
Okay, great. So I would like to end the show with one last question.
Sure.
All right. So untuk membantaraskan isu-isu seperti ini kan, do you think that there should be a holistic alliance dari semua pihak-pihak tertentu untuk to eradicate this issue lah?
Which issue in particular?
I mean regulations or even the proposal of a ban, things like
Right.
that. Yeah.
You mean to say get all the stakeholders involved lah?
Yes.
Well, I'm happy to report that actually kan, MOH do get all the stakeholders involved.
Yeah.
Right, they do. We were called for engagement, like libat urus from the very beginning tau. Okay, bila MOH ada meeting dipanggil, dia panggil the consumer representative, the business representative, the manufacturer representative, and they do listen. So I salute lah MOH. They do listen. But the problem is that itu ialah libat urus bila nak regulate. Tetapi bila keputusan nak ban, no,
it comes from a different force lah.
we are not involved.
Yeah.
We don't know.
Alright.
If you ask me who's involved in this decision, I don't know.
Tapi pelik when masa nak ban, they don't bring you guys into the meeting. Tapi for regulations, they bring you guys in the meeting.
Right.
Alright.
You know why?
Yeah.
Because the decision to ban, as I said earlier on, is based on perception.
Perception.
It's not
yes.
based on facts.
Alright.
That's the reason.
Alright. So fact checking and proper research is something that you are hoping to see lah from MOH's side in the years to come.
Right.
Yeah.
For instance kan,
Yeah.
it's just a short one lah. Before you decide to ban it, why not
Yeah.
conduct a research?
Okay.
Berapa banyak orang dah berhenti merokok kerana vape?
Okay.
Why not do that?
Alright.
Right? And then apa-apa produk yang laced with drugs and all that, you handle it. You enforce law, against it. Have a heavy penalty for these people. Then at the same time, tengok pada data berapa banyak orang yang boleh berhenti merokok kerana vape.
Alright.
Right.
And that's it. All right. So
Right.
thank you for joining us,
Most
Encik
welcome.
Samsul. All right. We'll see you around.
Sure.
All right. And we gave us really good insights.
Thank you.
Thank you, sir.
Right.